You're watching Public Affairs. Berkowitz is my name. Politics is our game. But we'll be doing lots of politics and public policy this evening because we have as our guest Dr. Sapan Shah. And Dr. Sapan Shah is running for the 10th Congressional District, in the 10th Congressional District Republican primary. He's running against or along with Jeremy Wines, Doug Bennett. Those are the three, you three are the three major candidates right now. All for the to run against Brad Schneider in the general election in November of 2018. We're taping this show on October 20th, 2017, so about 5 months left until the primary. I think the most important question is, what's the most important issue in the Republican primary that separates you from your opponents, Bennett and Jeremy Wines?
Well, let me tell you a little, Jeff, about my background and why
we'll
it
come
matters.
to that. We'll come to that. Well, I know that, and we'll get to. I always like to start with something that zings them. This is what people want to know. They will find out your background. I promise you, folks, during the show. So I know that's a little bit unorthodox, but this is an unorthodox show. So let's start my way. You tell them, the viewers out there, your potential voters in the 10th Congressional District, which is starts in Co, goes up to Zion, out to a bunch of suburbs like Lake Oil, North Lake Forest, Lake Bluff,
Sure.
and out to what Des Plaines is in there,
Like the
Libertyville
southern
is in
border,
there.
yeah, and then the northwest border around Lake Beach,
Okay.
northeast border at Zion and the state line.
Well, so you got some idea.
Yeah.
What is the most important issue between the three of you candidates?
Right now, I think it's about who is going to best handle healthcare and business issues in the country. Healthcare costs are out of control, out-of-pocket costs are out of control, total costs are out of control. So at every level of healthcare, we're spending too much and we're not getting the value we need. Obviously, my background matters for that. And then in terms of business, we need to do more to help entrepreneurs grow new businesses. And I think that that'll be the central question in this race is which of these candidates does the public believe will be most apt to handle those issues and help represent their interests on those issues.
And so when you say that, which will be most apt to will represent their interests, focus on the Republican primary. You know, there are probably going to be about 30,000 or so Republican voters. You got three candidates. If you were fairly even, I don't know, 12,000 votes might do it, right?
Well, I don't know the exact
Well,
numbers.
the
Okay,
point is,
I'm not a politician.
Let me withdraw
looking at
that. I don't want to
way,
get
but
bogged
yeah,
down in the math.
yeah.
The point is, you're not going to take a lot of votes to win the primary, and we're trying to get at some of the issues that separate the crowd or separate the three candidates. There may be more eventually, but when you say health care and getting costs down, should they repeal the Republicans are in charge now? They have the majority in the House, they have the majority in the Senate. If they can stay together, if they do stay together, the Republicans can repeal and replace Obamacare. Should they do that?
So your question was, what is going to be important to the Republican primary voter, and why am I well suited for that? So when we talk about healthcare, let's dig into it a little bit.
Okay.
When people are making choices for healthcare today, they don't know how much things cost. They often don't even know exactly how their coverage and benefits are going to apply to what they cost. They end up with higher out-of-pocket costs than they expected. They end up not even realizing or understanding the giant bills that come. Oh my gosh, I twisted my knee and tore my ACL walking down the steps, and now I have a $27,000 bill. What do I do with that? How does that intersect with, my coverages? Am I going to pay $1,000 out of pocket, $4,000 out of pocket? Would it have been majorly different if I went to one hospital or another? Those kind of questions for 8 or 10 years after 8 years now after Obamacare are unanswerable. The public doesn't have any more information than it did at that time, and the politicians in Washington have done very little to help predict those costs. And so while a lot of discussion happens about repealing and replacing Obamacare, which I would do, the core question is, what do you replace it with? And how do you replace it well so it's a functional system that works for patients all through our district, certainly, but also it provides some predictability in costs. Total costs weren't even addressed in Obamacare. Obamacare did absolutely nothing to address total costs. It also did nothing beyond indemnifying people that didn't have coverage. It met the obligations of broadening coverage, but it did nothing on the top end of saying, hey, we're going to control costs that we're underwriting.
Okay, so
And so when the public makes a decision about who they want to represent them in Washington, I think a key element of that decision is, does the candidate understand health care? Does he or she understand health care the way I understand health care? And who's best suited to make those changes?
all of that's possibly true, possibly not, because a lot of politics, we were just before the show, that it's important to look at public policy issues not always through the prism of politics. But on the other hand, you are running in a political race. You are involved in politics. You can't affect policy unless you get elected. You can't win the general election unless you win the Republican primary.
That's right.
So we start there, and a lot of the public starts when you go around seeking votes, and you're already going around to forums, especially to Republican meetings. When I say Republican meetings, I mean township meetings, whether it's Shields Township, whether it's Moraine Township, a variety of townships within the 10th Congressional District.
And they're wonderful townships.
I'm sure everyone
should
is.
visit.
Yeah, I love, like it's going, anyway, we love all you townships, we love all you suburbs that we are in, we love Chicago, we love Rockford, having established that in Aurora, all the places we live. Sometimes we are around, we love the state of Illinois. Okay, enough love for everybody? Okay, you feeling the love? But seriously, okay, putting that aside, so the threshold issue really is, do you want to repeal and replace Obamacare? Because the great majority of Democrats, I sense, would say no, and the great majority of Republicans would say no. But then the argument is, even within the Republican Party, well, what will they replace it with? And so, as you know, there's been that issue where they haven't been able to repeal and replace because they haven't been able to get the number of Senate votes. In the House, they think they could. We want to cover a lot of ground, and I'm sure you have a lot of ideas about on the cost side. We want to come back to that if we can, because we want to get at least 10 or 12 issues, and we only have so much time. I mean, you did a lot in education in terms of educating yourself, right? I mean, you went to Case Western for an undergrad degree, and then
I also have a law degree and a medical degree.
And a medical degree. And you did it all, the undergrad degree you got in 2 years, the law degree you got in 2 years. Folks, usually that's 4 years for the undergrad degree, 3 years for the law degree. And so he cut out 3 years right there. You had a jump in high school, I guess, because you took a lot of college-level courses then, and you're a smart guy. And then you went to medical school, and there you went all 4 years, right?
That's
the
correct.
Typical thing. And you went with your wife-to-be. And
Yeah.
that was, I understand, one of the reasons why you went to
Ended
law
up
school.
on that path, yeah.
You wanted
yeah.
to be with her for all 4 years.
Yeah, we didn't want to end up staggered, and she's a physician, and it worked out really well because she did end up marrying me, and we're really, really happy together. She's my best friend. She's also in private practice here. She's an allergy immunology specialist.
Yeah, and
So-
it's another boy meets girl story, right?
Yeah, we met when I was 18, she was 19.
Just like your parents. It was boy meets girl. They were both from India. They both came to Waukegan. They were both highly educated. Your mom's a CPA. She majored in math. Your dad was a metallurgical engineer. He's also went to like the equivalent of MIT, only, what is it, India?
It's called the Indian Institute of Technology.
So,
yeah.
man, this guy just oozes. You and your just ooze education.
No, it was
And I say
important
that
to
in a
our families.
complimentary
Yeah,
way.
it was important to our families, and it was certainly important to me.
And I guess does it reflect Asian or Indian culture?
I would say so.
Highly educated,
Certainly,
high value on education.
certainly the selected population that's in the United States. Because
But
that's
it does-
precisely why we're here.
So we raised the issue. You are Indian, right? Well, you would also say you're Asian. Do you identify, Asian would be broader than Indian,
Sure, certainly.
but do you identify with the Asian culture here in the 10th Congressional District? Do you look at that group as a base on which you work?
So a lot of your questions are political, and I have to admittedly say I'm not a politician.
Neither
Although
am I, but
I
I
am
play
now
one
a
on
candidate
TV.
for office, so I don't think a lot
Okay.
intuitively in terms of the political lens.
But you
So
better,
I don't
you
think in
better
terms
get,
of
you better
bases
get
or
good
others.
at doing that, because you're not going to win unless you.
Well,
when you campaign
I'm
manager-
I'm pitching the voters on hiring me, and I really look at this whole thing, Jeff, as a job interview for a particular position. And I believe I have a resume that matters. I believe I have a resume that is going to be representative,
Oh.
and it's going to help. And so I think the public can make their decision about it. Your question was whether Indian people in the United States, whether they would be supportive. I think in the district, there's a small percentage of Indian people.
Relatively
I don't think,
small in
I don't
terms
think
of
it's
registered
enough
voters.
to, yeah, it's a
And
relatively
don't-
small number.
and the Indians vote in large proportions. They tend to be low in voting, high in voting, average.
Our understanding is that they are lower in terms of the
Voting,
percentages
so
they
they
vote,
don't get out.
and they're a very small percentage. So to answer your question,
And two, are they more disproportionately Democrats than Republicans?
I think that there have been more Democrats in the past, but I think that particularly fiscal conservatism is something that most Indian people identify with.
Okay.
That said, I mean, the numbers are just so small, I don't think that they're politically, dispositive in any way for the 10th district.
All right, so is there, your strategy is to appeal to a broad base of people in the Republican primary initially, would that be correct?
I would say so. The Republican primary is likely going to be made up of Republicans, although it is an open primary, and Democrats can make a decision in the Republican
That's
side as well.
right. People often don't realize in Illinois, we don't have registered Republicans or Democrats. You can walk in and you can ask for a Republican ballot in the primary, Democratic ballot. So there are no registered voters in terms of party in Illinois.
Yeah, we're open. People are independent. And I would say also that the 10th district is about as independent a district as there is.
And so just going back to Obamacare for a second and how you would get the cost down, okay? Because everybody says, not everybody, but certainly the Republicans say they are all for competition. That's almost a defining trait of
Absolutely it is.
Republicans.
Absolutely it is.
And that's true for you.
It's a defining trait of America.
Well, you are not practice medicine, you have practice business. So you came out of med school, you started this, we're taping here in your company.
Flagship
in fact, in your
Healthcare.
office. Here,
That's
the
right.
Flagship Healthcare Company. Or is it Flagship
We
Healthcare?
just call it Flagship Healthcare.
Flagship Healthcare, FH for short,
Yeah.
okay? And it's kind of neat, okay? This guy, Dr. Sapan Shah.
That's right.
Dr. Sapan Shah just has this idea, it was about 10 years ago, right? Said, okay, people in medicine should practice medicine. And doctors often have group practices, they have to form together, they have to buy medical malpractice
Well, if I
insurance.
can describe it, Jeff, I mean, I think that in particular we're focused on the independent practice of medicine. We believe that it's a very efficient structure. We believe that it helps not only from a job creation, economic standpoint in the communities where physicians practice, but we think that fundamentally the delivery of health care in independent physician practices is more cost effective and efficient for any payer, public or private, than amalgamated health system, monopolistic type plays like the larger systems we're seeing today.
What is more efficient? Well,
Independent physician practices.
Independent, meaning a
Small
group
group
of doctors,
practices.
small group,
Small
as
group practice.
to,
As opposed to behemoth organizations of,
Like what?
1,000
give me an example.
physicians.
What's
There's single organizations that have taken over entire states and regions across
any
the country.
names that we know, any brand names?
There's several around here.
I'm just trying to get an idea, a feel for what you mean, other than
when-
it's larger.
when a
How does
hot-
it differ from you guys? How does it differ from your clients that are small practice? You represent.
Ownership, Jeff. I mean, the ownership of physicians we're talking about the move between physician-owned practices to large health systems that own practices and employ physicians as opposed to independent delivery of physicians.
And these large systems, are they publicly owned or
They
privately
could be privately owned. I mean, they
Okay.
could be large health systems in the area or otherwise.
But they tend to be larger, is your point.
They
might have
absolutely
a
are.
group of
They're exerting
500
their
doctors as opposed to
more than
6.
that, thousands. Yeah.
Thousands.
And their growth and dominance based on size, and the government and other payers have been slow to be able to demonstrate some of the increased cost that comes with that.
So I don't want to get, I could digress into the whole industry
Sure.
of your clients and who they compete with and all that. Interesting for another show. But
We'll have you
if
back.
you had to say now to your potential voters, what policy specifically, 1, 2, 3, in like 45 seconds. I'll give you 45 seconds.
Okay.
What policies you would advocate as a 10th Congressional District congressperson that would lower costs of health care for them?
Fundamentally, I think a place where the government can stick their nose into the healthcare marketplace is to require price transparency and clarity on a number of outpatient procedures, testing, and services that is not being done today.
So they would have to publish, the
They
government would
can
require them to publish prices, is that what you mean?
Yeah, demonstrate the guidance that would require providers of services, healthcare entities, to provide to you, the consumer, what something's going to cost that's an outpatient test, imaging, or service. It's a thing that can be done today.
If they did that, then consumers would be better informed and better able to
Absolutely.
make rational
We already know
decisions.
that, right? I mean, we already know people go from one store to another to get 10% off on a TV.
Yeah, you know,
And, you know, and they're not going to do that for a $4,000 MRI?
did you ever take a course in economics?
Actually, I've never taken a course on economics except for in law school. I took some finance
So you
courses.
might find it enlightening, okay? You might even still go back and do it. Microeconomics is what I recommend, you know, price theory. Because there is this view that a free market operates very well in a number of things, even in the provision of information. So if customers and your voters want this kind of information, you ever hear of Consumer Reports?
Sure.
So they do more quality.
Your
review.
analogy is flawed, though, in healthcare, because it's not that clear in healthcare, because most of the way that providers are paid are based on payer agreements that are shielded from the public eye. So there is no third-party entity that can go and provide that data. It has to be something that the payers, the providers, use their information from their payer agreements that they have in their file cabinets, and then come back and illustrate to the public, hey, this is what our expected numbers are for you on this particular
The
visit.
provider can't on his own put out this price information?
The provider could if they did it unilaterally, they could.
Yeah.
But it's
Why
not.
can't they do it
It's
unilaterally?
not being done because there's an incumbency issue, right? If I'm the only one doing it, and I'm benefiting from one payer paying more than another payer, perhaps, I'm creating a conflict within my own customer set without any prompting, without any
If you have a
reason.
group of doctors that they think they can provide services at a lower price than their competitors, wouldn't they want to put out that information? Wouldn't that be how competition works?
Jeff, I think it misunderstands the way that they're being paid right now. Right now, they
Who's
might be
being paid? The doctors?
the providers, whether it's a health system or a provider.
Yeah.
They're going to
By
have
provider,
15,
you mean?
a physician,
So, a group of
physician,
doctors.
an allied provider, a system provider, a lab imaging facility, any of those folks we're lumping together as providers. They might have 15, 20, 40, 50 payer agreements. And all those payer agreements have different pricing. And so a publication of that would
Do they
necessarily
have-
change their ability to compete for the next
Do
payer
those
agreement.
doctors, when they enter into these agreements, do they have any control or say as to what their price will be?
Typically, for individual doctors or individual entities, they have very little control. They
They have
simply have
some.
to
They-
accept it.
Oh, you mean
They can
can't-
either accept it or not
They
accept
can't
it.
go to another person and say, I'd rather work with you guys because it's
No,
lower than what we're saying?
sometimes what happens is they'll group together, and there's groups like PHOs and IPAs that will bundle contracts and things like that. But it's precisely why people with healthcare backgrounds, people that have been at the intersection of medicine and healthcare businesses, that should be at the table making these policies.
Okay, change the subject. You say we should cut spending, I think, right? When you say that, and that's in your promotional material, your campaign literature, when you say we, I assume you mean the federal government should cut the spending. Approximately, how much spending is there total in the federal government ballpark?
Last year, I think there was about $3 trillion. And,
$3 trillion.
no, excuse me, the revenue was $3 trillion. The spending was 118% of that.
So more like, what,
3.8,
3.8 trillion?
3.6, yeah.
Okay, close to 4 trillion. It has been,
3.6,
it has
yeah.
been 4 at
Yeah,
some points,
yeah,
maybe it's
yeah.
gone down to 3.6. Okay, $3.6 trillion. Where areas would you cut?
So I think the premise of the question actually needs to be a little different. Why?
Wait a second, wait, just
why
before
are
you, with all due respect.
No, but I
With all due
think,
respect,
Jeff,
you've been doing this the whole show. I get to ask the questions I want, and you have to try to answer them. That's,
Jeff, I'll answer
you
the
practice
question.
law. You practice law, right? No, you didn't practice, but you went to law school.
I do. I'm admitted to the
So I
bar.
used to practice law, and my favorite saying was when my witness went around and started asking me questions.
I'm not
I-
asking you a question.
I would say, fortunately,
I'm formulating
sir,
my response,
but
Jeff.
let me, here, I let you finish, do the same courtesy for me.
Sure.
Okay? Let me ask a question. So when I was practicing, sometimes the witnesses would say to me, they would ask me a question, and I would say, fortunately, sir, this is the kind of forum in which I get to ask the questions and you have to give the answers. So fortunately, sir, this is the kind of forum in I get to ask the questions and you're supposed to give the answers. So it's good to have critiques of my questions. I appreciate that. But for now, could I get some answers to my questions?
So let me answer this
Just
question.
start with the question I asked to refresh your recollection. The question I asked was, we have about $3.6 trillion by your statement of spending on the federal level. And we see these general statements by politicians all the time. You can say you're not a politician, but you're running office. We see these statements, cut spending, especially if you're a Republican, cut spending. If you're a Democrat, increase spending. I'm generalizing, folks, but that's what you see. Now, what we often don't see is a guy like me who says, could you tell us, at least in broad categories, where you would cut spending? Would it be in the defense area? Would it be in the non-defense area? Would it be on the medical side? Would it be entitlements? Could you give me some idea of where you would cut spending?
I'll answer your question, then I'll also answer something else. First, we've already talked about health care. Okay, our health care spending is out of control. The government roughly indemnifies about 100 million people between Medicare, Medicaid, the VA. And then subsidies as well for Obamacare.
Okay.
And those are places where we can reduce costs. We can reduce costs
All
even...
of those areas you mentioned would be areas, so you're advocating Medicare along with others?
See, what you're talking about, what you're looking for is one of these kind of take-home points from an interview that misrepresents what I'm saying.
My viewers,
That's not what I'm talking about. I'm talking about a real discussion, Jeff. If we're having a real discussion, let's continue to have a real discussion.
No, excuse me. I know my viewers, and they would like, when you list 5 categories, they would like me to clarify it and say, did you mean cuts in all categories and some? It's not a gotcha question. Unless you want to tell the voters.
That was your term, not mine. But it's the area.
Can we just find out something?
If we talk about health care, we've already been saying that within Obamacare itself, there was an enormous spending bill. Obamacare was an enormous spending bill. It provided Medicaid coverage to 14 million Americans. It provided subsidies for insurance payments to another 15 to 16 million Americans. A lot of costs, in fact, all of those costs in terms of indemnification, reduced the out-of-pocket expenses and improved coverage for patients, but didn't do anything for the total cost of the system. And those things have to be adjusted. Those are places where there can be reasonable agreement about reducing costs.
Could you give us any idea, other than somewhere in the vast healthcare system, you would like to see lower costs?
There's plenty. I'm trying to point out
some categories.
Let me answer the question in something that I think is really important that's not incorporated into your question. On a yearly basis, why is it that we consistently spend more money than comes in? And I think it's because the system that we have right now is made up of people in office, Jeff, that are in office, and they're going to outlive any president. They're going to outlive me and you. Some of them have been there as long as I've been alive. 100 people in Congress have been there greater than 20 years. I think decisions about spending don't get made properly are because people are going to perpetuate their own careers as opposed to being there for short periods of time and making reasonable decisions to cut spending.
We only have about 5 minutes left. Let me try to ask you 10 questions that'll take about 10 or 15 seconds each. If you could try to do the same in your answers, we can cover some ground.
I'll keep them short.
Okay. Tax rates, would you like to see them higher or lower?
Lower.
Okay. And you would vote for lower tax rates, individual and corporate?
Absolutely.
Okay. Would you describe yourself, if you had to choose one side or the other or somewhere in between, would you say you're a conservative, would you say you're a moderate, or would you say you're independent? Which of those 3 words comes closest to describing you?
I'm a conservative.
Okay. And are you familiar with Jeremy Wines, you're running against?
Yes. Yeah.
And he has said we haven't been able to get him on the show, folks. We have been able to quickly get Dr. Shah on the show.
I appreciate the invite.
And I appreciate you coming
here.
No
problem.
Despite a little friction on the questions.
It's not a friction.
But seriously, you've come here. This is what discourse is. Doug Bennett has come here. Mr. Wines said he'd call me back. That was about 2 months ago. He's looking for my phone number, I guess. I don't know. But Jeremy, don't be afraid. We're not going to bite. But we have to guess at some of your answers. So we've read you describe yourself, Jeremy, as an independent. And would you say you're not as independent, you are more of a Republican, as I try to...
Absolutely. I'm in the Republican primary.
Republican
Yeah.
Do you think Jeremy is more of an independent than a Republican?
You'd
Some
have
people
to-
say he's a Democrat. What's your perception?
You'd have to ask him. That's
Okay.
my perception. I'm running
Okay.
because I think I'm the best man for the job, and that's the way we're approaching
You
this
have a
campaign.
perception of Doug Bennett. He describes himself as a conservative,
That's
I
right,
believe.
yeah.
Would you say you're both conservatives, you and Doug?
I would say he's probably more conservative than I am.
In which way?
Certainly on some social issues.
Any in particular?
Abortion, I support a woman's right to choose.
Does that mean you would allow unlimited abortions?
No,
Time anywhere?
not at all.
What does it
Not-
mean?
Not at all.
What does it mean?
I think that when you look at the majority of states, they curb abortion at viability, and that's an appropriate standard.
At viability, so when you say they curb, what did the Supreme Court, when it sent up in Roe v. Wade, its sort of trimester
It connected it
approach?
also to viability.
Viability.
Yeah.
So that meant, I think, initially, the first trimester was completely unregulated. And I guess it evolved into the second trimester was also unregulated. Does that sound right?
I don't think I
Is that
understand.
the current state of the
I
law?
don't think I understand the way you're characterizing it. I think what they're saying is that viability is a time frame before which you cannot abrogate abortion.
Okay. Is it your view, and you have a medical, I don't.
And it's more of a libertarian view for me, Jeff, because I really believe that the government shouldn't be involved in
I
that
understand
decision.
that. Again, I don't want to get on, because
Yeah.
you've said you
Yeah.
pro-choice, and I understand, they understand what that means. Now, I just want to hone in a little bit. Does that mean, in your view, in your understanding of the law, you are a lawyer, you are a doctor, is pretty much in the first 6 months of a woman's pregnancy, she can choose to have an abortion, and an abortion can be provided. The government cannot interfere with that right during the first 6 months. Would that be your understanding?
It's my understanding that 6 months or 6 weeks.
6 months. Because, you know, the issue of partial birth abortion, or so-called late-term abortion, has come up, and there's a question of whether that can be regulated. But that
No, I
usually
think
is referred
partial-
to as the last 3
No,
months.
I think partial birth abortion is outlawed right now.
You think it's, okay.
Yeah.
So when can a woman have an abortion?
According to the states that she lives in, there will be an abortion statute. Nationally, our standard is viability. And so there can be no abrogation.
No, can you give me
That's
a
what that
number?
is.
You're saying there's no number.
Viability is...
The law is really vague, is what you're saying. And
It's not
viability
vague.
can-
I didn't say that.
No,
You
but-
said that.
well,
I did not say that.
Can you give me a number?
I did not say
Is
that.
it generally 6 months that a woman
vast-
can have an abortion, 7 months, 8 months, 9 months? Just give me a number. Is there one?
No, the vast majority of states are somewhere between 24 and 26 weeks.
That is, vast majority of states say it's 24 weeks would be 6 months. So the vast majority of states say in your first 6 months, they're not going to regulate abortions. Is that right?
Well, they have other regulations on abortions, Jeff. I'm not sure what you're getting
Okay.
at there, but...
Okay. I was trying to get an answer, folks, to the question, what is Dr. Shah's view about abortion? When would he say a woman should be able to have an... If you think you've answered the question, fine, and they will judge it,
yeah.
okay?
I said I support a woman's right to
One
choose.
last question, and then we're going to get out. Short answer. Club for Growth, Grover Norquist has a thing called a tax pledge. You pledge not to increase taxes. Have you taken that pledge, and would you take that pledge?
I haven't taken the pledge. I'd have to think about it.
You have to think about it. Okay.
You know, I think the absolutes in politics are not useful today.
And on that note, folks, we're going to get out. We've just about run out of time. We very much want to thank Dr. Shah for coming here, giving us his views, giving you his views. We hope we'll come back. We didn't nearly cover what we need to cover in both domestic policy, not at all on foreign policy. So we've enjoyed it. I hope you've enjoyed it. And you just remember, you come back next week and every week to Public Affairs.